Hi, lovely people. This is Albert once again. We'll continue with our, cancer education. My last video, I talked about the epidemiology of prostate cancer. Today, we're going to be continuing, with the risk factors. What increases a person's risk of getting prostate cancer? So these are the common risk factors. There are other risk factors, but I'm just going to concentrate on the most common ones. So the first one is age. Your risk of getting prostate cancer increases, with age, mostly 50 years and above. A lot of that is when, most of prostate cancers are diagnosed. But there've been a downward trend for black men. Let me put it this way. People of African descent or Black African Americans are at a higher risk of developing prostate cancer. The reason why I said the age, there is a downward trend especially for Black Americans. The studies suggest or says 50 years and above is when a man can get prostate cancer. But for Blacks or African Americans, the age is kind of lower. I think there have been cases where people in their lower 40s, middle 40s that are getting diagnosed with prostate cancers. So if you are a Black, or African American or Caribbean descent, it is important that you kind of keep yourself on check, because yes, the studies suggest 50 years, but people actually get cancers in their lower 40s and mid 40s. So just kind of keep that in the back of your mind, that Black African Americans are at a higher risk of developing prostate cancer. The next risk here is family history. Now, if you have a first-degree family, what I mean by that is when your father, uncle, brother, or somebody, or your son, has a prostate cancer,